Hello, Dr. Sam Gaston here with North Texas Sport and Spine, bringing you another video in our conditions series, just covering some common conditions that we see here in practice and common conditions that you may have heard of just in your everyday life. Today we are going to talk about carpal tunnel syndrome, which a lot of people have heard of, but there is a lot of confusion about what it actually is. So the carpal tunnel is in the wrist. It's formed by the carpal bones, which are your wrist bones. You've got the flexor tendons underneath, which flex the wrist and flex the fingers. Then you have the median nerve that runs right through there and goes sensory to the first three fingers here. And then you have the transverse ligament across the top of that, which forms the actual tunnel there. So with carpal tunnel syndrome, you have pinching or compression of that median nerve, and that leads to some of the symptoms that you commonly get with carpal tunnel syndrome, which would be numbness, tingling, pain, pins and needles type feeling through that first three finger distribution like that. And a lot of times that's worse at night. So what are some of the causes of carpal tunnel syndrome? There's a bunch of them. One of the most common ones is overuse or repetitive type of injuries, whether that be from typing at a computer or doing repetitive motions, working with your hands, whether you're twisting nonstop, using a wrench, using a hammer, something where you're just doing a repetitive motion over and over and over again. That can eventually cause things to tighten up, bones in there to shift, and it can put pressure on that median nerve, which closes down that carpal tunnel, which leads to that carpal tunnel syndrome. So another common cause of it or association with it is pregnancy. A lot of pregnant women end up with problems and pain and numbness in their hands, and one of the main causes of that can be carpal tunnel syndrome. When you're pregnant, your body releases a hormone called relaxin that causes all of your ligaments to loosen up, not just the ones in the pelvis, but throughout the entire body. So you get that ligament laxity throughout the wrist, things start to move, and that can put pressure on that median nerve. So now that we have an idea of what carpal tunnel is, we'll talk about some of the potential treatments for it. So you can treat it across a wide variety of options. You can start with anti-inflammatory, something like that, if it is an inflammatory irritation of that nerve. But if it's anything other than inflammation, it's not really going to fix the problem. Sometimes people will get steroid injections in there, but again, if it's not from inflammation, if there's another cause to it, it's not really going to solve the problem. Here in practice, when we work with carpal tunnel syndrome, we take a multifocal approach to it. There's going to be a lot of stretching and some strengthening of the forearm muscles. We got to stretch them in case the tendon being too tight is what's causing that pressure. And eventually we got to strengthen it, because if it's an overuse type injury, most of the time you're not going to be able to stop doing the thing that caused the problem. And so you're going to need those muscles to be stronger so that you're not putting as much pressure on the wrist itself. We also will do wrist adjustments to make sure the 8 bones of the wrist are moving correctly and not putting any pressure on it. And then, some stretching, strengthening at home as well is going to be important. So a lot of stretching of the wrist flexors, stretching of the wrist extensors there, just making sure the wrist is moving the way that it's supposed to, and get the pressure off the nerve and get the wrist functioning, again, how it's supposed to. In some cases, surgery becomes an option, and they're generally successful. But again, just like with all the rest of these potential treatments, if you don't fix the cause of it, be that typing too much, bad ergonomics at work, repetitive job tasks at work, then it's going to be a problem long term. So that's just a little outline of carpal tunnel syndrome, and look forward to some other videos this month about other common conditions that we treat.